Well, good morning to everyone, and particularly everyone out here. We are actually on the campus of Cal State Long Beach to give our update to the community, as well as a media update on COVID-19 and the pandemic. A few of us were actually just right now at the opening of new student housing on campus. About 470 students will be on campus in the fall in addition. And so I want to congratulate Dr. Connolly for that opening today that we were just at. We're joined here today on the campus of the university by, of course, the president of Cal State Long Beach, Dr. Connolly, the superintendent president of Long Beach City College, Dr. Mike Munoz, also the superintendent of Long Beach Unified School District, Dr. Jill Baker, and Kelly Colopy, who, of course, heads up our Health and Human Services Department at the City of Long Beach. Today, we especially want to talk about where we're at with the pandemic, but also really focus on vaccinations and talk a little bit about what our different institutions between Cal State Long Beach City College, Long Beach Unified School District, and the city. We represent the four largest public institutions in the entire city, but also the largest employers. In fact, Long Beach Unified School District is the largest employer in the city of Long Beach, and all of our institutions make up a significant portion of the workforce population, as well as, of course, particularly within the education sector, almost the entirety of it. I also just want to note that we are, as a community, grateful as to where we are as it relates to vaccinations, knowing that there's still a lot of work to do. To the 72% of eligible adults in our city that have chosen to get vaccinated, thank you. You have done your part, and you are working to beat this pandemic. And to the 99% of seniors in Long Beach that have made the decision to get vaccinated, also thank you. Just a phenomenal number, and we know that health is at the center of the decisions that you are making. Now, just over a month ago, the case rate in Long Beach was less than 1.4 per 100,000 people. That case rate now is up to 22.4. Our positivity rate, which was at 0.5%, is at 7.9% today. So the pandemic, and as it relates, our fight to stop it, is becoming more difficult by the day as the virus, and especially the variant, particularly the Delta variant, is expanding throughout the community. And I know we've all heard a lot about this. Specifically today, we want to talk about our education system. We are at a point now where schools are going to be coming into session at the university, college, and school district level in just weeks in front of us. And there are still folks, students, some staff within our institutions that still need to get vaccinated. And in fact, if we want to have folks double vaccinated, the time to get vaccinated before the start of these schools is right now. Briefly, as we probably noted yesterday, the city put in a new mandate. We are, in the city of Long Beach, going to be requiring a mandatory vaccination for all city employees or the proof of a weekly COVID negative test. We know also that that 72% of our employees are vaccinated, which we are grateful, but we still have more work to do there to ensure that we get everyone vaccinated, hopefully in the city of Long Beach. If you are a city employee in our community, I'm also asking each and every one of you to understand that we work for the public, and the standard of what is expected of us is higher. And we also have to ensure that we're meeting this moment where people are looking to us for leadership. This vaccination requirement will also be put in place for all city commissioners and everyone that I appoint at the City of Long Beach. And with that, I want to turn this over to our leaders of our education institutions, all of who have done an amazing job of guiding us and guiding our students and our kids and our families to where we are today. And they're each going to provide an update about where we are at and where their institutions are at with the vaccination process, and then also answer any questions from the media. So let me turn this over and begin by handing over the microphone to our host, Dr. Jane Close Connolly of Cal State Long Beach.
Thank you, Mr. Mayor. And welcome to Cal State Long Beach. So glad to have you. I echo the mayor's points exactly, and we'll just add that universities are places typically with high density indoor spaces. So we must take all the precautions we know to be scientifically grounded to ensure health and safety. And recall that although only about 50% of our classes will be face-to-face, that still equals almost 20,000 students. So it's very important that these 20,000 students, plus the staff, plus the faculty, do not become a danger to our Long Beach community. And we know that vaccinations not only protect the individual from serious illness and death, but protect the community. We also know that the Delta variant and possible future variants will be limited when a high percentage of people are vaccinated. So a vaccination, our scientists tell us, our health department tells us, and national health experts tell us, protect the person, the community, and battles the development of more and more variants. For these reasons, the campus and the system reached the decision to implement the previously announced vaccine mandate and do it now. I'm confident that every member of our community will do the right thing and not come to the campus unvaccinated. In the very rare cases that a vaccination is impossible, we will require indoor and outdoor masking and regular testing to, again, protect the individual and the community. We've asked everyone to be fully vaccinated by September 30th, although August 23rd, the start of school, would be the ideal time. Our students, faculty, and staff, and visitors deserve to be in a safe place, and after months of study, we're confident that this is the best way forward. Thank you very much. And now I'll introduce Dr. Mike Munoz, Superintendent and President of Long Beach City College.
Thank you, Dr. Connolly. And thank you, Mayor Garcia and fellow Long Beach College Promise partners. Since the start of the pandemic, Long Beach City College has worked to serve as a partner with the City of Long Beach in fighting the COVID-19 pandemic. We work hard to ensure that our campuses are safe for our students and for our community. Our two campuses serve as testing sites. Our Pacific Coast campus has been one of the City of Long Beach's location for a vaccination distribution site. LBCC student nurses have been out in force working closely with the city's health department at the convention center, administering vaccinations and at the testing sites. Not only helping our community, but providing our students with the hands-on experience to become the next generation of healthcare heroes. We are extremely proud of them. We announced today to our campus community that we will be following the City of Long Beach's lead to require proof of vaccination for both of our students and our employees. Those who do not provide this info will be required to test for COVID regularly. Today, we join our partners to encourage our students, our campus community, and the many communities LBCC serves to get vaccinated. We are only going to beat this pandemic if we do this together. Long Beach City College is busy prepping for our partial return for fall 2022. Fall 2021. We're hoping to see a full return in spring of 2022. However, considering the age range of people least likely to get the COVID vaccine are between the ages of 18 and 29, the same age range as the majority of our LBCC students, it's important for this group to understand that they are not immune from the Delta variant. The Delta strain has been hitting young people particularly hard, and California community colleges are having the tough conversations about mandating vaccines for students, staff, and faculty. LBCC's fall semester starts at the end of August with in-person, hybrid, and online classes. In order to do this as safely as possible, we need as many of our students to be vaccinated. With 1 month left, it is perfect time to get it done. Be fully vaccinated before the start of the semester. Let's work together to protect our family, friends, classmates, colleagues, neighbors, and the greater community. Do your part to protect the people you love and care for most. Thank you again, Mayor Garcia, for bringing us together today. And now I would like to turn it over to Dr. Jill Baker, LBUSD's Superintendent of Schools. Thank you.
Thank you, and good morning, or almost good afternoon. We are so fortunate to continue our partnership with the city, our health department, and other agencies to provide COVID vaccination opportunities for as many people as possible. You heard Mayor Garcia say that we are the largest employer in the city, and already thousands of our employees were vaccinated early in the spring because of the prioritization of educators by the mayor and the health department, which enabled us to return to in-person instruction for our students as the first in the state. Those early vaccinations received attention. As we returned to school, the New York Times featured us and the city as the largest school district in California to successfully begin to bring students in for in-person instruction. That same employee vaccination program from spring was key to us being able to educate 14,000 students in person during summer, successfully educate and bring students back. Many of them had not been back to school since the pandemic began. And so this is the beginning of our time of returning all students to in-person instruction. Why is in-person instruction so important? You've heard story after story be told that in-person instruction is the most effective way for most of our students in K-12 to receive their education, especially our early learners. We tried to make the best of virtual learning, and credit to our teachers and our principals and support staff for the job that they did, but nothing in K-12 replaces an in-person experience for our students. And so we look forward to having all of our students back on August 31st, which the countdown is on, is 33 days from today, when thousands of our students will return to campus. The Long Beach Unified School District has not yet established a mandate that staff or students show proof of vaccination, but we know that a persistent focus on vaccinations right now will be key to the continued success of our school and the fall semester. Because of the sheer size of our organization, by extension, a successful and safe return to in-person learning this fall will help to ensure the economic success and the health and safety of our community and the communities they serve. But we need everybody's help, and that's why we're here as a collective today. Students age 12 and older and family members of LBUSD students can still receive COVID vaccines at various community clinics, and we will continue to partner with Long Beach Health and Human Services to provide school-based clinics. We're continually sending clinic information to our families and our staff as new clinics become available, using all of our resources, email, our website, our social media channels, and other avenues. The evidence is clear, and that's why we're standing together, that vaccines work, they save lives, and they bring us to a sense of normalcy in the way that we all desire. They will continue to be an important way to protect yourself if you're watching, and not just yourself, but others. Although vaccines are not currently required of our school district students or staff, we strongly encourage all eligible community members and staff and families to get the COVID vaccine. Thank you. Apologies, I'm turning over to Kelly Colopy, Director of Long Beach Health and Human Services.
Good afternoon, everybody. I just wanted to first start out by thanking our education partners in this work. We've been allowed to provide testing and vaccine on multiple Long Beach Community College campuses, well, on the two, as well as multiple Long Beach Unified sites. So it's really been a wonderful partnership and the ability to support and engage our community members to provide opportunities as close as we can into the neighborhood to be able to provide both testing and vaccine. So the Delta variant is much more present in Long Beach. It is the variant in Long Beach, Southern California, and across California. It's quickly spreading. It's more likely to cause severe disease, especially among unvaccinated people, and is now everywhere. As the mayor mentioned, our case rate has gone from 1.4 per 100,000 on June 15th to 22.4, and the positivity rate is up to 7.9. If you remember the tiers that we were all living in, we are well into the purple if we were looking back at our earlier times when we were more fully shut down. But in that time frame, because of vaccine, we have not needed to move to that level, and instead we're focusing on masking. Overall, we've seen a 12-fold increase in cases, and per the CDC, we are considered in high transmission. The available COVID-19 vaccines provide protection against this new variant. The more people who are vaccinated, the lower the chance that any variant, including the Delta variant, can get a foothold in our community. Vaccines are safe, they're effective in preventing COVID-19, and they're very effective against serious illness, hospitalizations, and death among those who may have a breakthrough case. The percentage of people who've been vaccinated and become positive remains very low. Right now, of those who have become positive after a vaccine, it's only 0.1%, so still very low numbers. Very few people who are vaccinated become hospitalized or die. Recently, 99.8% of COVID cases COVID-related cases, deaths across Los Angeles County were unvaccinated people. The vaccine does work. I really want to encourage all community members 12 and older to get the vaccine to protect themselves and to protect our city and keep it safe and healthy. For more information, just in case you haven't heard it multiple times, is that you can visit VaxLB website at longbeach.gov/VaxLB, or you can call our hotline at 562-570-4636. So the current surge in COVID-19 cases due to the variant has been an alarming factor, and it is leading to new levels of orders. So earlier this month, we updated the city's health order to reinstate the use of facial coverings for everyone in indoor public settings and businesses. We know this was frustrating for many. People felt like if you got the vaccine, there were going to be no more steps. But the vaccine is a strong protectorant, and it's a key tool in our toolbox to keep the community safe, but it's not the only tool, and it can't be the only tool we rely on. When we started the vaccine, the Delta variant was not around. So the Delta variant is 50 to 70% more transmissible than the original virus, so we need extra precautions. The CDC has found that the small percent of people who are vaccinated become infected by the Delta variant, that they also can transmit it. So we are asking that you protect yourself and you protect those around you, whether you are unvaccinated or vaccinated, and certainly vaccine is the most important step in addition to the masking. As we stand here with our school partners, it's important to plan for back to school. So you heard some dates about when school was starting. So if you're coming back to school to Long Beach Unified, August 3rd is your last day that you can be vaccinated with the Pfizer vaccine for 12 and over and still make it on time, fully vaccinated, ready to walk in the door. August 3rd, a key date. Students who age 18 or older have 1 dose of vaccine or 2-dose vaccine options. And so, but those who are 12 to 17 are only eligible for the Pfizer vaccine. So we want to be paying attention to what those timelines are. So the time is now to make sure children are protected against COVID-19 and up to date for all of their vaccines. Minors must have a signed consent, but that can be online when you sign up for an appointment or on site. So with that, I'll end my statement, and we're open for questions. Thank you.
Thank you, Kelly. We have a question from Julie Stone from ABC 7. Right now, Long Beach and LA County would be in the purple tier if we still had the colored tier system. At what point do you feel there could be another lockdown if cases continue to increase? Kelly,
At this time, what we're seeing is, that the vaccine is very effective, and if we start to see real increases in the hospitalizations, right? So we're really focusing on the hospitalization and deaths, and knowing that 99% of our population over the age of 65 is vaccinated helps. We are seeing an increase in our hospitalizations, but not anywhere near where they were in the height of the pandemic. So we'll be continuing to track on that and looking at the effectiveness of the vaccine, and we'll make determinations as the numbers indicate.
thank you, Kelly. We have a question.
One more thing. I'm going to add one more thing to that. I want to make sure we note this because I think I want to deliver the point more clearly. What's happened this week as it relates to our population that is the least vaccinated, even though they're doing okay, is that 18 to 30-year-old group. So within the community, young people are the ones that still need to get vaccinated the most. So the decisions by Long Beach City College and the Cal State system, Cal State Long Beach, who serve that population, I think is significant. Particularly at the Long Beach City College District, so many of those students live in the community. These students live within our city and surrounding neighborhoods. So we really believe that the college and university mandates are going to make a strong impact, hopefully in the weeks ahead.
Thank you, Mayor. We have a question from Melissa Evans from the Long Beach Host for Dr. Connolly, Dr. Munoz, and Dr. Baker. What percentage of faculty and staff at LBUSD, LBCC, and CSULB are currently vaccinated against COVID-19? Also, will LBCC and LBUSD be requiring proof of vaccination for faculty, staff, and students heading into the fall semester?
We estimate that about somewhat over 70% of our faculty and staff are fully vaccinated. And yes, we will be requiring proof of vaccination as we return to school. We'll start collecting that data within the next just few days as we get an online form in place and attestation and a way for them to upload proof of the vaccination.
Thank you. And at Long Beach City College, very similarly, we, based on survey data, we estimate about 70% of our employees are vaccinated. And since we've made our announcement today that we will be requiring proof of vaccines, we will begin to collect the process. The process will begin in the next coming weeks, so we'll have better concrete information in the next coming weeks.
In Long Beach Unified, we estimate a similar percentage of vaccinated employees based on our early vaccination program in the spring, around 70%, and probably several percentage points since we did the early vaccine program. And as I shared previously, right now, it is not a mandate to provide proof of vaccination. That's under discussion.
Thank you, Dr. Baker. Jeremiah from the Long Beach Post has a question for Kelly or the mayor. With 49% of police officers and 58% of firefighters potentially unvaccinated, there's a good chance of someone getting unvaccinated first responders showing up if they call 911. And with the city's current rules, those unvaccinated first responders don't have to wear masks unless they're inside with other people. So my question, is that safe for the people calling 911? And how do you make sure the risk of having an unvaccinated, unmasked first responder showing up isn't deterring people from calling 911?
At this time, the people, when they are out and when they are near people, whether they're going to someone's house, whether they're in their car, when they're in an ambulance, anywhere, they have their masks on. When they are responding to people in the field, they're also wearing their masks. So that you will notice that police and fire have their masks on when they are near people.
Jason Ruiz from the Long Beach Post.
Let me add one more thing. Now, I'm going to add just that every city employee should be getting vaccinated. And at this point, I know that we're constantly looking at our masking rules right now about how we're going to move forward. But for folks that are fully vaccinated, whether you're a police officer, firefighter, our expectation is most of our departments have public-facing employees, some that work with the public very intensely: police, firefighters, homeless services, health folks. So it's our ask that if you're not vaccinated, to please go get vaccinated. I think that's the most important thing.
Jason from the Long Beach Post has a question for the mayor or Kelly. Since the Delta variant has arrived in the city, has there been an increase in cases among fire and police officers? If so, how big of an increase, and has anyone become seriously ill?
I don't have an answer to those numbers. So we can provide them later.
Next question, we have Haley from the Long Beach Press Telegram. Question for Dr. Connolly, Dr. Munoz, and Dr. Baker. Are LBUSD, CSULB, or LBCC planning additional health measures beyond mandatory vaccines or frequent testing?
Well, we have in place a number of mitigating procedures. We are continuing a heightened cleaning schedule. We have installed, from my estimate, miles of plexiglass so that people with student-facing and other public-facing jobs have some barrier between them. We've also limited the size of groups, and as our students come back, our residential students are required, they have already been required to show proof that they're vaccinated before they can move into the dorm, and we've had 96% compliance there. And, we've changed our food service so that there's no more buffets and things are individually wrapped. So there's a whole host of activities that have gone on during the pandemic that we anticipate will be continuing at least until we get better numbers from our city health department that give us more confidence that it's a safe place to be. We'll be masking in our pyramid and any other indoor sports that we have. And we'll wait to learn what we should do for our outdoor sports as we keep following the science.
And at Long Beach City College, very similar to Cal State Long Beach, we've been heightened our cleaning protocols. But I think one thing that we've done for fall semester for our face-to-face classes is we have reduced the class size capacity. So we identified what the room capacity was in the room, and we reduced it to 50%. So regardless of what the class size of record was, we made sure that we had a reduced class size in our classrooms to provide more room for social distancing.
Long Beach Unified will continue its health and safety protocols that were established in the spring, including additional cleaning measures with high-tech equipment that helps to, on a daily basis, keep classrooms as clean as possible. In addition, all of our staff and students will be masking while indoors on campus. Most of you know that the CDC just reinforced that from a federal level, and we're hearing that from the California Department of Public Health and our local health department. So we will continue to mask students. We've purchased additional hand washing stations and hand sanitizer as part of our protective equipment and protective resources at school sites, and we will continue to use those as we open school on August 31st.
Thank you. And that concludes media questions and answers.
Great, thank you. I'm going to do a very kind of a short recap in Spanish, and then I want to thank everyone for joining us. Mi nombre es Roberto Garcia, soy el alcalde de la ciudad de Long Beach. He estado acá en la Universidad de Long Beach con líderes y liderazgos de nuestra comunidad de California State University Long Beach, del distrito de Long Beach City College y también el distrito de Long Beach Unified School District acá en la ciudad de Long Beach. Estamos acá unidos para, por favor, decir a las familias que es tiempo para dar vacunas para todos en nuestra comunidad. Acá es importante que sepan que si tú tienes alguien de 12 años o más, pueden tener una vacuna, y ya que va a empezar el colegio, que va a empezar la universidad, el colegio comunidad, también va a haber diferentes reglas en que gente va a tener que tener vacunas, depende de dónde van. Quiero bien rapidito decir esto. En la ciudad de Long Beach, al 72% de nuestros que trabajan para la ciudad tienen su vacuna. Estamos nosotros poniendo una nueva regla que si tú trabajas para la ciudad de Long Beach, tienes que tener tu vacuna o poder dar cada semana a verificación que no tienes COVID-19 en un examen. Eso va a ser en la ciudad de Long Beach. En la Universidad de Cal State Long Beach, todos los que traen, los maestros, los estudiantes, los que vienen a la universidad, van a todos tener la vacuna en la California State University acá en Long Beach. So, si eres un estudiante o trabajas acá o es profesor, vas a tener que tener esa vacuna. En el college de Long Beach City College, también va a ser bien igual como en la ciudad, que vas a tener una oportunidad, si tú trabajas acá en el Long Beach City College, es un estudiante de Long Beach City College, vas a tener que tener vacuna o poder enseñar a la semana un examen que no tienes COVID-19. En el distrito Long Beach Unified School District, eso es algo que ahorita también están viendo cómo van a ser en el futuro, pero están también pidiendo a todos los estudiantes de 12 o más, también a los que trabajan, los profesores y que están, que están con los estudiantes, que también por favor tomen la vacuna. Y ahorita el Delta variant está más poderoso que en otro tiempo acá en la ciudad de Long Beach. Por favor, haz la cosa que es la ciencia, y estamos todos pidiendo que por favor agárrense la vacuna. Es fácil, es gratis y es importante. Muchas gracias.